Good evening, everyone. My name is Dr. Spirit, and this is my channel. I help you with all sorts of things, all the elements. I can help you out with it because I am either skilled in it or I am educated in that. So, uh, thank you for coming. But I trust in your unfailing love. My heart rejoices in your salvation. This is Psalms chapter 13, verse 5. So let's get on with my talk. It's on sleepwalking, everything almost. Okay, let's see here. Hmm, ah, let's see. Ah, let's see here. This is interesting. I used to sleepwalk when I was little growing up. Uh, I understand now why I was very stressed. Okay, sleepwalking, also known as somnambulism. Woo! That's a long winded word, I tell you. Is a sleep disorder where people walks or performs other activities while not fully awake. Here's a comprehensive overview. Yes. First, the causes are sleepwalking can be triggered by various factors, including genetics. A family history of sleepwalking increases the likelihood. Sleep deprivation, lack of sleep, can contribute to sleepwalking episodes. Stress, high levels of stress or anxiety can trigger sleepwalking. Sleep disorders, conditions like sleep apnea, that's interesting, can increase the risk. Medications, certain medications such as sedatives or hypnotics can induce sleepwalking. My sleep pill, when I take a whole one, my daughter tells me I sleepwalk. And and I see evidence of it. I do a strange thing when I am sleepwalking, and I do it all the time, and I don't understand it. Uh, it's strange. Okay, I get food, like say for example, uh, maybe some chips out of the cabinet, and maybe I don't know, a croissant or something. And the last time I remember, no, I don't remember. When I got up, there was a napkin on the counter with some chips in it, and just there. And when I was, I saw it there, but I didn't think about it. I said, oh, you know, and put I got up and noticed there was chips on the floor and chips in the bed, but I don't eat it. Okay, and that's me on my sleepwalking. Symptoms during a sleepwalking episode, a person might sit up in the bed. They may sit up and look around with a glassy eyed expression. When my daughter was young, I think she was about 3, she used to have night terrors, guess you could call them, and it's like sleepwalking. She would just wake up, her eyes be wide open, and she'd be crying, 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 you know. And I couldn't wake up. So I would take her in my bed with me, and she would stop and go to sleep. Walk around. They might walk around the house or even leave the house, perform routine activities like eating, dressing, or driving. My sister said she was driving and it was sleepwalking. Lack of awareness. The person is usually unaware of their actions, yes, and might not respond when spoken to. Yeah, my daughter have to wake me up. Well, she don't wake me up. She leads me. She told me what she does. She leads me to the bedroom and tell me to go to sleep and cover me and help me down and all that. But I don't remember nothing. Uh, diagnosis. Diagnosing sleepwalking typically involves medical history review. A healthcare provider will review the individual's medical history and symptoms. Sleep study, I've had that done. Sleep study, polysomnography. This studies, not this one, monitors brain waves, heart rhythms, and other vital signs during sleep to identify abnormalities. Okay, treatment. Treatment for sleepwalking may include improving sleep habits, ensuring regular sleep patterns, and avoiding sleep deprivation. Stress management techniques like yoga, the same as the other. PTSD, yeah. Like yoga, meditation, and counseling can help uh, reduce stress. Medications, in some cases, medications like diazepam may be prescribed to help manage sleepwalking. Safety measures. Oh, yeah. Ensuring a safe environment to prevent injuries during sleepwalking episodes. Self care tips: create a safe sleep environment, remove sharp objects, and lock doors and windows. Establish a bedtime routine. A consistent routine can promote deep sleep. Avoid stimulants. Limit caffeine and avoid digital devices before bedtime. Complications. While sleepwalking is often harmless, it can lead to injuries. The person may hurt themselves or others during an episode. Sleep deprivation. Frequent episodes can lead to excessive daytime sleepiness, behavioral issues, embarrassment, and social relationship problems can arise. Sleepwalking is more common in children and often decreases with age. However, if it persists or causes significant issues, seek medical help and advice. Okay. How can I prevent sleepwalking in children? Preventing sleepwalking in children involves creating a safe and stable sleep environment, addressing any underlying issues. Here are some effective strategies. One, establish a consistent sleep routine, regular bedtime. Ensure your child goes to bed and wake up at the same time every day, even on weekends. Relaxing bedtime routine. Create a calming pre sleep routine, such as reading a book or taking a warm bath. I used to read to my daughter. Okay. Create a safe sleep environment. Okay. Remove hazards, clear the bedroom of sharp objects and obstacles that could cause injury during a sleepwalking episode. That's true. Lock doors and windows. Ensure all doors and windows are securely locked to prevent your child from wandering outside. Install safety gates. Use safety gates. Block stairways and potentially dangerous areas. Address underlying issues. Manage stress. Help your child manage stress and anxiety through relaxation techniques like deep breathing, meditation, or yoga. Treat sleep disorders. If your child has other sleep disorders, such as sleep apnea, seek treatment from a healthcare professional. Avoid triggers. Limit stimulants. Avoid giving your child caffeine or other stimulants, especially in the evening. Removes, reduce screen time. Limit exposure to screens, TV, tablets, smartphones before bedtime, as the blue light can interfere with sleep. Number five, use anticipatory wakings. Schedule awakenings. If your child sleepwalks at a predictable time, gently wake them about 15 minutes before the usual sleepwalking episode and keep them awake for a few minutes before letting them fall asleep. That's a good idea. Six, monitor and support. Keep a sleep diary. Track your child's sleep patterns and any sleepwalking episodes to identify potential triggers and patterns. Seek professional help if sleepwalking persists or causes significant issues. Consult a healthcare professional for further evaluation and treatment. By implementing these strategies, you can help reduce the frequency and severity of sleepwalking episodes in your child, and also help adults too, and ensure their safety. This definitely would. I, I'm glad my daughters keep the doors locked and the windows and everything, so I don't wander out. So, uh, in conclusions, these are all the things that can help you or a parent if your child is sleepwalking. So, uh, read these, go over these, and if it can help you implement them. And if you need a healthcare worker to do a sleep study on your child or yourself, call up and make an appointment. All right. And thank you so much, everyone. Let's see here. What else can I tell you? Oh, all right. What's the most beautiful natural landscapes you've ever seen? Oh, when I went to Puerto Vallarta, I still remember it and the sounds of the birds and the smells. It was so, so amazing. I'll be going back and I look forward to it. All right. So that Puerto Vallarta. All right. So remember to take care of yourself and each other. And please pass this information on. Someone might need it. Thank you so much. Good night. And namaste, everyone. Thank you.